All right, so before you start this station, you want to make sure the equipment's going to be set up the same way it will be when you do the test, or you can also rearrange the things how you would like them. So I would make sure that the oxygen tubing, I know it looks kind of tangled, but make sure it's not actually in a knot. Your suction, it can be assembled or disassembled, it really doesn't matter. OPAs organized largest to smallest. You should have your BVM with the mask attached. And then the oxygen tank, the way this station will work is that the tank will be turned off, so righty-tighty, this will be off, and the regulator should be set to 0 or off for the start of the station. Okay, so I've checked my equipment. I'm ready to begin.
All right, you may begin.
Okay. PPE, scene is safe. Sir, are you okay?
There is no response.
Elicit a painful stimulus with a shoulder pinch.
No reaction from your patient.
Okay, I'm going to call for an ALS and I'm going to call for an AED. I'm now checking pulse and breathing for no more than 10 seconds while opening the airway.
You find that your patient is completely apneic and has a weak pulse of 60.
Okay, I am going to look in the airway.
You find that the patient's mouth is full of vomitus and secretions.
Okay, I'll suction the airway to clear the vomitus and secretions. Test this on my hand to make sure it works. Insert no further than I can see. Suction on the way out for no more than 15 seconds.
The mouth and oropharynx are now clear.
Okay, I will now insert an OPA to maintain the airway, measuring from the corner of the mouth to the earlobe, opening the airway to help with insertion of the OPA.
Patient accepts adjunct, no gag reflex present.
Okay, I will now ventilate the patient with a BVM, giving 1 breath every 5 to 6 seconds. 1, 2, 3, 4, 5. Breath. 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 1, 2, 3, 4, 5. Breath.
Ventilation is being properly performed without difficulty.
I'll recheck pulse and breathing for no more than 10 seconds.
Your patient's condition is unchanged.
Okay, I will now attach my BVM to oxygen. Go ahead and turn the oxygen tank on. Adjust the flow rate to 15 liters per minute. And continue ventilating my patient. 1, 2, 3, 4, 5. 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi, 6 Mississippi. 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000. 1, 2, 3, 4, 5. Breath. 1, 2, 3, 4, 5. Breath.
How would you ensure that adequate volumes are being delivered with each ventilation?
Adequate rise and fall of the chest. I'm finished with this station. And then please reset the materials for the next person.